Hi, Level 1 students. Welcome. It's good to be with you again. We are in this new normal environment because of this COVID-19 pandemic. And the School of Medicine had to do a lot of retooling in order to bring the content of our instructions online into the comforts of your home. So, welcome. And we are now entering the fourth bi-monthly, and our first module would be module 12, which is consists of the anatomy of the head and neck and also the endocrine system. Now, for this presentation, I will be talking about only the general points of the anatomy of the head and neck because as you very well know, the head and neck is a very comprehensive topic. It is quite lengthy. And if we will discuss everything here, we might consume the whole day, and you might most probably get bored. Okay, so we'll just stick to the important points. Okay, so to start off, okay, let's first consider the regional landmarks of the head. Okay, as you can very well see on the screen, these are the different regional regions of the head. And why is this? Why do we need to know this? Because you must know that these landmarks actually serve as important reference point for locating injuries, localization of presence of any pathologies, and also for proper communications with your fellow medical professionals. No, if you are trying to report to describe an injury of the head, you must have particular reference point in order that you will be understood by your fellow doctors. So, and this is the importance of using regional landmarks. Okay. Now, going to the bony framework of the head, otherwise known as the cranium, or commonly we refer it to as the skull, it is actually made up of two parts. The first is your neurocranium, this one, and your viscerocranium, or this one. The neurocranium serve as the bony case of your brain. Okay, so it is in this area where your brain is situated, and it is made up of two parts. I mean the neurocranium. The first is your calvaria or skull cap, this one, which forms a dome-shaped structure of the neurocranium. And the second part is the cranial base, or the base or the floor of the cranium. Sorry. Okay. The calvaria is actually made up of several flat bones, such as your frontal bone, parietal bone, occipital bone, temporal bone, and they are joined together by this one, interlocking sutures, which are actually made up of fibrous joints. Okay, while your cranial base or the floor of the cranium is made up of irregular bones. And what are these bones that forms your cranial base? Well, these are your sphenoid bone, the ethmoid bone, as well as the partly the temporal bone. Okay. The other part of the cranium is your viscerocranium, which can be found on the anterior aspect of the head. And majority of it is actually made up of your facial bones, no? Like your maxilla, your zygomatic bone, the frontal bone, the nasal bone, the lacrimal bone, and also the mandible. The bulk of the facial bone is actually formed by your maxilla, this one, which serves as the bony support for your upper jaw, while the mandible serve as the support for your lower jaw. And by the way, it is only the mandible that is the movable part of the all the bones of the head. No, it is only the mandible that is movable. Okay, so these are the bones forming your neurocranium. Okay, just to reiterate, your frontal bone, your parietal bone, okay, your occipital bone over there, partly your temporal bone, and those forming your viscerocranium or the anterior part of your skull is your facial skeleton, this one. You have your maxilla over here. You have your, what do you call this? Lacrimal bone over here, nasal bone, okay, and your mandible. Okay. Now there is a term known as pneumatized bone. What are pneumatized bone? Well, these bones are those bones that contain hollow spaces. Example of which is your frontal bone, which contains your frontal sinus. Another would be your maxillary bone, which contains your maxillary sinus, ethmoid bone, so on. And the reason for that is it is believed that these hollow spaces serves to lighten the weight of the skull. Okay, and aside from that, the presence of these hollow spaces serves as some sort of a voice resonator. Okay, okay. Now, covering your cranium, okay, is a musculo-aponeurotic sheet of tissue, which actually runs anteriorly from the supraorbital margin, and it goes over the dome of the cranium to be attached posteriorly to the superior nuchal line. Now, laterally, it goes down to be attached to the temporal fascia and also to the zygomatic bone. Okay. Now, if you notice, each letter of the word scalp actually represents the 5 layers of the tissue. First is your skin, this one, which, as we very well know, is made up a lot of hair follicles, numerous sweat and sebaceous gland. Okay. The second layer, C, is your connective tissue, which is actually a dense layer, and this layer is very vascular because most of the blood vessels or the branches of the artery supplying the scalp runs within this layer. So if you have a wound to the scalp, you will notice that it bleeds profusely. It is because of the presence of this dense connective tissue layer. The next layer is your aponeurotic layer or the epicranial aponeurosis. In other textbook, they call it Gallia aponeurotica. And this is actually an aponeurotic sheet which expands the dome of the calvaria and serving as attachment for the frontalis muscle as well as the occipitalis muscle. Okay. The next layer, L, is the loose connective tissue layer. Okay. This layer, from the name itself, is called loose because it is made up of areolar connective tissue. And it is actually this layer that is responsible for allowing the first, the second, and the third layer of the skull to glide over the cranium, over the cranial bone. That's why the scalp is very flexible, no, over the cranium. It is because of the presence of your loose connective tissue. And the fifth layer or the deepest layer is your pericranium, which formed as the external periosteum of the cranial bone. Okay, so this is the scalp. Okay, How about we mentioned that the scalp is well vascularized. Okay, what are the blood vessels that supplies the scalp? Majority of which actually comes from your external carotid artery. This one. This is the external carotid artery, which is one of the terminal branches of your common carotid artery. Okay, it sends blood to the scalp via the superficial temporal artery, which supplies the parietal, occipital, as well as partly the frontal region of the scalp. Okay. Another would be via the occipital artery, this one, which brings blood to the occipital portion of the scalp, and also the posterior auricular artery, which brings blood to the mastoid region of the scalp. Okay. There is another source of blood aside from the external carotid artery. That would be coming from branches of the internal carotid artery. The internal carotid artery, by the way, enters the cranial cavity via the carotid canal, and one of its branches is the supratrochlear artery, as well as the supraorbital artery, which emerges from the supraorbital foramen over here, okay, and supplies the frontal portion of your scalp, okay. So this is why your scalp is bleeds easily, and also this is also the reason why you rarely get an infection involving an injury to the scalp, because like I said, it is well vascularized, and that's why wounds of the scalp heals very fast. This is the venous drainage of the scalp is actually via a series of veins that just corresponds to the name of the arteries that supplies the scalp, such as your superficial temporal vein, you have your occipital vein, posterior auricular vein, the supratrochlear and supraorbital vein, and the superficial temporal vein, as well as the posterior auricular vein, actually, and also it also receives branches from the maxillary vein. Actually, they form what is known as your retromandibular vein, this one, just behind the uh, angle of the mandible, and they receive also communication coming from the facial vein to form the common facial vein, and eventually most of the blood from the scalp will drain into the internal jugular vein. Okay. Now there is a term called dangerous area of the scalp. Now, where is this dangerous area of the scalp, and why is it called dangerous? Well, the dangerous area of the scalp is none other than the loose connective tissue layer, this one, the loose connective tissue layer. As we learned before, it is a loose connective tissue because this layer is quite made up of areolar connective tissue. And because of that, there are potential spaces in this layer, potential spaces that can allow blood and pus to collect and to spread within the layer. Okay? So, and what is dangerous here is that if you have pus that collects within this layer, you must also know that within the layer, there is a vein that traverses through the layer, known as your emissary vein. Hence, purulent material within the layer can gain access into the intracranial cavity via the emissary vein. You might end up with a brain abscess or a meningitis. Okay. Okay, going now to the face, okay, just like the head, There are also anatomic landmarks of the face that allows for proper description and localization of injuries and pathologies. Okay, we will not anymore describe what are these landmarks because the photo here says 1,000 words. Okay, so just be familiar with these landmarks. Okay. Okay. Now beneath the subcutaneous tissue layer of the scalp and the face are series of muscles that when they contract, they cause contortions of the face that conveys mood and emotions. These are what is known as your muscles of facial expression. Okay, these are the muscles of facial expression over the frontal aspect of the dome of the skull, also at the posterior portion, also muscles around the eye, muscles around the nose, muscles around the mouth, and also over the neck. Okay, one of these muscles, if they contract, can convey a particular type of emotion. Okay, so this is a photograph showing the mechanism of action of the different muscles of facial expression and the specific emotion that they convey. Okay, so be familiar with this. Okay, how about sensory innervation? We talked about already about arterial supply, venous drainage. How about sensory innervation? What innervates the head and neck region? Okay. Now, for the facial region, okay, the cutaneous sensory innervation is actually served by your trigeminal nerve or the fifth cranial nerve via its three division. We have your ophthalmic nerve, okay, which serves this area over here. You have your maxillary nerve and your mandibular nerve. They are all divisions of the trigeminal nerve. The ophthalmic and the maxillary nerve are purely sensory, while the mandibular nerve has a motor component, as we will learn later on. What is this motor component of the mandibular nerve? How about the posterior aspect of the scalp and the neck? What mediates general sensation within this area? Sensation within this area is actually mediated by the dorsal rami of the spinal nerves, specifically of the cervical spinal nerves, while the anterior portion of the neck, okay, sensation travels via the anterior rami of the cervical spinal nerve, which in this area, the anterior rami of the cervical spinal nerve form a series of plexus. Okay. Now, talking about motor innervation of the face and as well as the head, okay, they are mediated by three nerves. The first is your facial nerve or the seventh cranial nerve, which supplies majority of the muscles of facial expression. Okay, except for the muscles around the eye, such as the orbicularis oculi and the muscle that is responsible for closing the upper eyelid, which is the levator palpebrae superioris, which is actually mediated by your oculomotor nerve. Okay. The another motor innervation of the muscles of the face is via the mandibular division of the trigeminal nerve. Okay, and this motor innervation, okay, of the mandibular division of the trigeminal nerve is the one that controls the muscles of mastication or the muscles that we use when we eat. And these are the masseter muscle, this one over here, the temporalis muscle over the side of the side of the skull. And you have your lateral and medial pterygoid muscle, which we cannot see here because it is located at the inner surface of your mandible. Okay, so these are the motor innervations of the face and the head. How about the arterial supply? What artery supplies the face? Well, just like the scalp, the face is also well vascularized. So what does that mean? If it is well vascularized, it bleeds easily, but any wounds on the face will also heal very easily and much faster. Okay, if an area is well vascularized. And also, they tend to resist infection. Okay. Now, majority of the blood going to the face is via the external carotid artery. Okay. And specifically from one of its branches, the facial artery, which takes off just at the level of the angle of the mandible. Okay, it goes over the body of the mandible. Okay, it ascends superior medially towards the medial angle of the palpebral fissures, and along its course over the lateral to the angle of the mouth, it sends branches to the upper and lower lip, to the nose, to the maxillary region, to the cheek, and also to the medial aspect of the orbital cavity. Okay. Aside from the facial artery, there is another artery, another branch of the external carotid artery, which sends blood to the deeper structures of the face. And that is via the maxillary artery, this one. Okay. Venous drainage of the face. Well, as we mentioned earlier, just like the scalp, the venous drainage of the face is via veins named after the corresponding arteries that supplies the face. Okay, example would be your facial vein, which is the main venous drainage of the face. Okay, as well as your maxillary vein. Okay, the facial vein goes down inferolaterally over the angle, over the inferior border of the mandible. It goes over to the angle of the mandible and joins with the it joins with the anterior division of the retromandibular vein to form the common facial vein, and it drains into the internal jugular vein. While the deeper structure of the face is mainly drained by your maxillary vein. This, okay. There is also what is known as the dangerous area of the face. Where is this dangerous area of the face? Actually, it is a triangular area bounded by the both angles of the mouth going up to the bridge of the nose, which forms the apex of the triangle. So this is the dangerous area of the face. Now, why is this term the dangerous area? I think it has something to do with its peculiar venous drainage, because the venous drainage of this area, this one, has communication with the cavernous sinus. Now, the cavernous sinus is a venous dilatation within the cranial cavity, specifically at the base of the brain. Okay, because of this special communication with the cavernous sinus via the superior and inferior ophthalmic vein, any infection within this area, any pustule infected pimple, or any infection within the nasal cavity, especially one that is caused by vigorous picking of the nose, which can lacerate or scrape the nasal mucosa and cause an infection, or any infection in this area, especially if you press if you press this infected part, especially a pustule, they can gain access retrogradely into the cavernous sinus and can cause a thrombosis in this area, causing what is known as the cavernous sinus thrombosis, which can present with paralysis of some of the facial muscle. Or worse, the infection that can travel in this area can cause a brain abscess. So be very careful. If you have pustule, pimples infected in this area, never try to press on them, okay? And never try to pick your nose vigorously or try to remove your nasal hairs because they can cause an infection of the hair follicles there, causing intranasal folliculitis, which can spread the infection to the cavernous sinus. Okay, now going over the neck. Now, the neck is a region of the body in between the head and the trunk, okay? What is unique about the neck, it contains a lot of structures that traverse from the chest to the neck and from the neck back to the chest. And this consists of segments of the alimentary tract, segments of the, what's this, respiratory tract, and also blood vessels that brings blood to and fro between the brain, between the head and the trunk. So that's why the neck is very important and it is a very dense region. Just like the head, there are also landmarks over the neck, okay? Landmarks that will help us localize injuries. And these landmarks are formed by a series of triangles, which are demarcated specifically by your sternocleidomastoid muscle, which divide the whole neck region into two big triangles. You have your anterior triangle and your posterior triangle. And each of these triangles are further subdivided into a series of sub-triangles. This one, okay? So these are the different sub-triangles, okay, over the anterior portion of the anterolateral portion of the neck and also over the posterolateral portion of the neck. Now, we will not anymore discuss the borders, the boundaries of each of these triangles and their contents. So I leave that to you for your reading, okay? So this is a photograph of a cadaver specimen, okay? This is your sternocleidomastoid muscle here. Over traversing the sternocleidomastoid muscle is your external jugular vein. This is your platysma muscle, still covered by your superficial fascia. So this would be the demarcation for your um, anterior triangle. Okay, anterior border of the sternocleidomastoid muscle, inferior border of the mandible, and an imaginary line running vertically to the midline of the neck. And this is your posterior triangle. Okay. Okay, how about the bony structures or the bony support of the neck? What forms the bony framework of the neck? Well, it is formed by your cervical vertebrae, the seven cervical vertebrae, 3 of which are atypical and 4 are typical. Okay, now we will not anymore discuss the different features of typical and atypical vertebra. So, reading assignment na lang na. But one peculiar feature of your cervical vertebra is the presence of a foramen on each of its transverse process. This is the transverse foramen, from which the vertebral artery will pass through. Okay, the vertebral artery, which is a branch of your subclavian artery, it will pass through here, and it will enter your cranial cavity to form, to be, to contribute to the formation of your circle of Willis at the base of the neck. Oh, sorry, at the base of the brain. Okay. Another bone of the neck is your hyoid bone. Now, this bone is very unusual because this is the only bone that is isolated from the rest of the skeletal framework because it has no articulation with any bone. It is actually held in place over the anterior part of the neck by several muscles of the anterior portion of the neck, such as your suprahyoid muscle and your infrahyoid muscle, as well as by this ligament, the stylohyoid ligament. Now, what is the function of this bone, hyoid bone? Well, aside from serving as the attachment for the different muscles of the neck, it is believed that this bone also aids in keeping the larynx open, or in keeping the airway open. Okay. Now, let's go now to the different layers of the neck. Okay. Now, the different structures, the visceral structures, the muscles of the neck are actually, sorry, are actually wrapped by a series of fascia layers, no? The first of this fascia is your superficial fascia, this one, the one in white, which runs circumferentially around the neck. Okay, this superficial fascia contains variable amount of fats depending on the habitus of the individual. It also contains blood vessels such as your anterior jugular vein, cutaneous nerves, lymphatic vessels, as well as a very peculiar muscle, flat muscle. This one, known as your platysma muscle. Okay. Now, next to your superficial fascia, of course, is your deep cervical fascia. Okay. But the deep cervical fascia in the neck is further subdivided into 3 layers. Let's go first to the first layer. The first layer is known as your investing layer of the deep cervical fascia, the one in red, which, just like the superficial fascia, also runs circumferentially around the neck, and at specific points, it splits into 2 layers to enclose some of the superficial muscles of the neck, such as your sternocleidomastoid muscle anterolaterally, as well as your trapezius muscles located posteriorly. Okay, the next layer is your pretracheal layer. This is the layer of fascia that surrounds your thyroid gland, as well as your trachea, as well as your esophagus. Aside from that, the pretracheal fascia also sends sheaths to enclose the strap muscles of the neck. This one. Okay. Now, this pretracheal fascia, okay, posteriorly becomes your bucopharyngeal fascia over here. Okay. Now, the next or the deepest layer is your prevertebral layer. This one, or the prevertebral fascia, the one colored orange, which forms a tubular sheath around the vertebral column, specifically around the cervical vertebral column, and its and including the muscles that attach to it. Okay, this is the prevertebral fascia. You notice this green, circular green line. Okay, This is actually a fascial condensation coming from the 3 layers of the deep cervical fascia. They condense to surround the neurovascular bundles of the neck. And this is known as your carotid sheath, okay, which runs from the base of the skull up to the root of the neck. When you say root of the neck, then that would be the level of the first cervical rib or the level of the thoracic inlet. And this carotid sheath, okay, contains your common carotid artery medially, located medially, the internal jugular vein located laterally, and posteriorly the vagus nerve. And you can only access the carotid sheath if you detach the sternocleidomastoid muscle, this one. Okay. In order to access this, so we have to detach this on the cadaver. No? Okay. This is your platysma. Platysma is a flat muscle running on the superficial fascia of the neck. It originates actually from the deep fascia covering your pectoralis major muscle as well as the fascia that covers the deltoid. Okay, there are actually 2 sheets of platysma, one on the left, one on the right. They ascend superiormedially and attaches to the inferior angle of the mandible, and they fuse with the different facial muscles, different muscles of facial expression. So this is the platysma, still covered by the superficial fascia. Okay, these are the different muscles of the neck. They're actually arranged in different layers. You have your superficial group and your deep group. Okay, the superficial group runs anterolaterally, and they are made up of the platysma over here. Okay, then you have your sternocleidomastoid muscle, as well as your suprahyoid muscle. Suprahyoid because they are attached to the superior border of your hyoid bone. And this includes the digastric muscle, the stylohyoid muscle, this one, the mylohyoid muscle, which forms the floor of the oral cavity. And below the hyoid bone, you have what is known as the infrahyoid muscle. Okay, this series of long rectangular muscle that appears like leather straps. That's why they are known as strap muscles. Okay, they are made up of your sternohyoid muscle, the omohyoid, specifically the superior belly of the omohyoid. Then underneath these two, you have your sternothyroid muscle. Then above, you have your thyrohyoid muscle. So they constitute your strap muscles of the neck. Okay, and the deep muscles, which we cannot see here because we need to detach the sternocleidomastoid muscle as well as the platysma. Okay. Okay. Pause muna. So this is your sternocleidomastoid, your platysma muscles, which we reflect superolaterally, exposing your sternocleidomastoid muscle. You notice that it still contains your investing layer of the deep cervical fascia. Okay. And these are your strap muscles. Okay. This is the sternothyroid muscle. This is the omohyoid muscle over here. The sternohyoid muscle, which we cannot see because it is reflected superiorly, but we can see its contralateral part. This is the sternohyoid muscle on the right, and the omohyoid muscle, okay? And here you have your thyrohyoid muscle, which originates from the lamina of the thyroid gland and attaches to the hyoid bone. You have your cricothyroid muscle over here. This is already the tracheal cartilage, showing you the eminence of the tracheal cartilage or your Adam's apple. And this is your thyroid gland over here. Okay. Now the carotid sheath is still within this area, so we need to reflect the sternocleidomastoid muscle laterally and superiorly to visualize the neurovascular bundle, as well as to visualize the deeper muscles of the neck, like your scalene muscles and your prevertebral muscles. That's the submandibular gland over there. Okay. Okay, we have already talked about this, so we will just skip this slide. Okay. So again, the infrahyoid or strap muscle. To reiterate, this is your superior belly of the omohyoid. This is your sternohyoid muscle, still partially covered by your pretracheal fascia. Okay, if you reflect these two, you will be able to visualize the sternothyroid muscle and the thyrohyoid muscle, as well as the thyroid gland. Okay. Okay. Um, this is a photograph showing you the pretracheal fascia, which covers your thyroid gland. Okay, this is the pretracheal fascia here, the one in the blue line. Okay, the blue line. Okay, that's the pretracheal fascia. By the way, your thyroid gland is actually covered by a very tough capsule which sends septae towards the parenchyma, and on top of the capsule is your pretracheal fascia, which wraps the thyroid gland and attaches in it anchors it to the trachea posteriorly. Okay. Okay, these are the deep group of muscles. You have your scalene muscle here, your scalenus anterior, scalenus medius or the middle, scalenus posterior muscles. So these are muscles that are attached to the first and second rib and superiorly to the transverse process of your cervical vertebrae. These muscles are also considered accessory muscles of respiration because they stabilize the upper part of the thoracic cage. Okay. Now, in between the scalenus anterior and the scalenus medius muscle, okay, you can see the brachial plexus emerging, as well as the subclavian vein emerging to become the axillary subclavian artery emerging to become the axillary artery going into the upper extremity. Aside from that, you can also see the phrenic nerve emerging in between these two muscle bundles. Okay, another deep group of muscle, which is the deepest, is your prevertebral muscles, okay, which runs anterolateral over your cervical vertebrae. These are your longus capitis and longus colli muscle here. They are already very deep, okay, but we will see them later, okay, in the cadaver specimen. Okay, now just showing you the scalene muscles. Okay, this is the scalenus anterior muscle. This is the scalenus medius muscle. This one, scalenus anterior, scalenus medius, that one, and in between is your brachial plexus emerging. That's here is the brachial plexus. Okay, and this at the back here is your scalenus posterior muscle. And in between also, in between the anterior and middle scalene muscle, you can see the phrenic nerve over here. Okay, we were able to visualize this because we have what we call this. We have reflected the SMC, or your sternocleidomastoid muscle. We also reflected the uh, internal jugular vein over here. This is your common carotid artery. You have here your phrenic nerve, and you have here cut end. I think this is the external thyroid artery, cut end from the external carotid artery. This area here is already the bifurcation of the common carotid artery. Okay, this view shows you the prevertebral space or the retropharyngeal space. This is the area over here. So it is behind the esophagus and the trachea. This area over here, the prevertebral space. Okay, and this space is very significant because this space actually communicates inferiorly into the superior mediastinum. And if you have infection within this space, let us say a retropharyngeal abscess, once that abscess rupture, okay, it can gravitate inferiorly into the superior mediastinum and can cause the fatal condition known as your mediastinitis. So this is space. This is your, by the way, this is the esophagus being retracted medially. This is already the pharynx over here, the inferior part of the pharynx. This is the trachea. This is the thyroid gland. This is the left lobe of the thyroid gland. Okay, this is the isthmus over here. Okay, being retracted are your common carotid artery as well as your as well as your internal jugular vein, okay, cut end of your superior thyroid artery. Magnified view of the prevertebral space will reveal also the presence of your prevertebral fascia. This one, this translucent, transparent, whitish sheet that covers your prevertebral muscle. This one, this prevertebral muscle, this one. Okay, that one. Okay, medially, this is your cervical vertebrae. This one. Okay, and this is the vertebral fascia, the one in orange, which surrounds the prevertebral muscle as well as the muscles of the posterior part of the neck. Okay. Okay, arteries of the neck. Okay, what are the arteries that supplies the neck or that traverse the neck? Well, you have your common carotid artery. Okay, especially what is shown here is the left common carotid artery, which originates from the arch of the aorta. The right common carotid artery is actually a branch of the brachiocephalic trunk, which is a direct branch of the arch of the aorta. Okay, then the common carotid artery goes up, okay, underneath the sternocleidomastoid muscle, and at the level of the superior horn of your thyroid cartilage, the common carotid artery bifurcates into two terminal branches. We have your external carotid artery, this one, which is the one that sends branches to supply the extracranial portion of the head. That means it supplies the parts of the superficial and the deep structures of the face, as well as the scalp. And you have also the other terminal branch is your internal carotid artery, which enters your carotid canal to send branches to supply the meninges, of the brain as well as the parenchyma of the brain. Okay. Aside from your common carotid artery, another artery that traverses the neck is a branch of your subclavian artery. This is the vertebral artery, passing through the foramen transversarium on its way inside the cranial cavity to contribute to the formation of the circle of Willis at the base of the brain. Okay, this is the vertebral artery. Okay. By the way, the common carotid artery itself does not give branches to the neck. It is only the branches of the external carotid artery that give supply to the structures of the neck. Okay, these are the veins of the neck, which just corresponds, okay, uh, to the name of the arteries that supplies the head and neck region. But most of the blood of the neck eventually drains into two common routes. The first is your external jugular vein, which runs superficial to the sternocleidomastoid muscle, and it empties into the subclavian vein. By the way, your external jugular vein is the, what do you call this? It is actually the vein that you will see, no? If you see someone singing and that individual is trying to hit a high note, you will notice a bulge on the lateral aspect of the neck, okay? That bulging vessel there is actually your external jugular vein. Another route of drainage of the head and neck structure, aside from your external jugular vein, is your internal jugular vein, which is the main drainage conduit of the head and neck region. This is the external jugular vein, which we can only visualize if we remove your sternocleidomastoid muscle. Okay. This is the blood vessels of the neck, no? Being visualized after reflecting the sternocleidomastoid muscle, revealing the huge internal jugular vein, that one. And laterally and medially, you have your common carotid artery. Now, at the back, you can see a cord-like structure. That is actually the vagus nerve. Okay. In actuality, both these three structures are covered by a fascial sheath known as your carotid sheath over here. Okay, this is the carotid sheath. So this is the curvilinear reddish line here shows the where the carotid sheath no, wraps these neurovascular structures. Okay. Okay, sternocleidomastoid muscle, external jugular vein, very visualized here, is your submandibular gland. Okay, just underneath the inferior border of your mandible and within the digastric triangle of the neck. Okay. Okay, we will reflect this one. The sternocleidomastoid muscle. There. Showing you the internal jugular vein, vagus nerve, common carotid artery, scalenus anterior, medius muscle there, posterior, scalenus posterior muscle. That's your brachial plexus over there. Okay, I think here, there is your phrenic nerve. Okay, in between the anterior and middle scalene muscle, that's your phrenic nerve. Okay, vagus nerve. Okay, that is the cut end of the superior thyroid artery. This area here is already the external carotid artery. Going up there is your internal carotid artery. Of course, this is your strap muscle. Okay. to access the prevertebral space, we have to retract the bundles, this one. We have to retract the common carotid and what's this? Internal jugular vein. Okay, that's the thyroid gland. Once we have elevated the strap muscles, okay, that's the cricothyroid muscle, thyrohyoid muscle, thyroid eminence, okay. Okay, this is the thyroid gland, okay, which, as you know, is the biggest endocrine gland of the body. And it is one of the endocrine glands of the neck. The other is the parathyroid gland, which is located behind the thyroid gland, behind this structure, okay? Now the thyroid gland, as you can see, is shaped like a shield. It has two lobes, right and left, connected by a bridge of thyroid tissue known as your isthmus. Now, at about 10%, you can have what is known as your pyramidal lobe, which is a remnant of the embryonal thyroglossal duct, no? Okay. Now, the thyroid gland is a well-vascularized organ, means when you injure this, it can easily bleed. It receives its blood supply from two sources. One is via the superior thyroid artery coming from the external carotid artery, which descend over the superior pole and divide into two branches to supply the anterior and posterior part of the superior pole of the thyroid gland, as well as to supply the upper part, the upper portion of the parathyroid. As you know, there are actually 4 parathyroid glands distributed behind the capsule of the thyroid gland. Okay. The other blood supply of the thyroid gland comes from a branch of the subclavian artery. This is the subclavian artery. And before the subclavian artery emerges in between the scalenus anterior and medius muscle, it gives off a trunk known as the thyrocervical trunk. And one of its branches is your inferior thyroid artery here, which goes behind the thyroid lobe, okay, to supply the posterior and the anterior portion of the lower lobe, as well as to supply the lower parathyroid gland. Okay. And there is also another branch which is not constant, another blood supply of your thyroid gland, which is not constant. It is present only in about 10%. It is known as the thyroidea ima artery, which is actually a branch directly from the brachiocephalic trunk here. It's not visualized here. But there is that branch known as the thyroidea ima artery. Okay. Again, showing you the thyroid gland. Okay. Okay, the submandibular gland over there. Okay. Which is, by the way, is a mixed salivary gland. Okay, it produces both mucinous and serous salivary secretions. Okay, that's it. So thank you very much. Stay safe, everyone. And we'll meet again online next time sa atong SGD. So please read on your on your task sheet. I believe the task sheet has already been given to you. Okay. So thank you very much and see you next time.